And if it becomes law in its current form, this health care reform could mean different things for different people. Your age, your health record, your financial status all play a role in your coverage. ABC 7's Jess Dowdrick joins us live from Sarasota Memorial Hospital with a look at what this effort to revamp health care could mean for you and your family.
Good evening, Haley. If you're older, you could end up paying 3 times the premium that a younger person pays for the exact same plan. Some people who are currently on Medicaid won't qualify anymore. And if you have a pre-existing medical condition, your coverage options could be limited.
I'm very uneasy and very afraid of what this might mean to me and many other people.
Debbie Sergi Laws has been living with HIV for 30 years.
Health care in itself, though, has been extremely expensive. It seems to be always an additional stress, making it very difficult to try to stay well.
But she says Obamacare lowered premiums, making it easier for her and others fighting the virus.
I found many of them were able to get additional care that they never had gotten before.
Healthcare coverage for those with pre-existing conditions, like Debbie, could soon change with the recent amendment of the GOP healthcare plan.
What they're doing is they're allowing the states a little bit more freedom, so there's not a one size fits all.
States could decide whether or not to continue with the rules protecting those with pre-existing conditions, or they could create a high-risk pool to cover those individuals.
They're still able to get the federal funding, but they're also saying, you know what, if we want to do it our own way, we can file a waiver, and let's say we don't want to deal with it the way the federal government is telling us to do it. Maybe we want to deal with pre-existing conditions in another manner, and that's what this amendment, the MacArthur Amendment, is allowing the states to do.
The bill allocates $8 million over 5 years to go to states that apply for the waiver to help cover the costs of care for people with pre-existing conditions. Trump's administration claims that under no circumstance can people be denied coverage because of a pre-existing condition, but those with pre-existing conditions could be paying more. Other changes that would come with this health care reform: you would no longer be required to have insurance, and you wouldn't be penalized if you do not have it. Also, health insurance companies would be required to cover maternal care, prescription coverage, and also mental health care. Live in Sarasota, Jess Dowdrick, ABC 7, your Suncoast News.
Thank you, Jess.